All right. Hi, everyone. My name is Stephanie. I work at the Center for Alzheimer's Research and Treatment at Brigham and Women's Hospital. It is part of our neurology department, but we basically just run a couple of observational studies and clinical trials centered around not only Alzheimer's disease, but also aging. And I'm here today partnering with Neighbor Health East Boston to bring some educational materials not only about the state of Alzheimer's disease, but also throughout the next few weeks, we'll be doing Zoom videos every Friday. And so here I have an outline of this 3-week series. Today we'll be talking about what you need to know about Alzheimer's disease, the basics behind any symptoms, prevention, things like that. And then next week, we'll touch on clinical trials, basically what it encompasses in terms of participation and the types of trials we have available at our center. You can find us in the Longwood medical area of Boston. So hopefully it's kind of near East Boston, relatively. But yeah, the last week, which will be on Friday, August 8th, we will talk about support services, especially for caregivers. This is anybody that is caring for someone with Alzheimer's disease. So even if it's family, if it's your job, even patients at a clinic, it might just be helpful to tune into the type of support services that are available to you in your community. All right. Going forward today, as I already mentioned, we'll be talking about Alzheimer's disease in general. If at any point you have any questions, please feel free to raise your hand, unmute yourself, stop me whenever. But I'll also be taking questions at the end, if anything. Okay, so to start us off, I want to give a little bit of background about our brain and the different parts of it. In Alzheimer's disease, the main parts of the brain that are impacted are this frontal lobe, which we see in yellow, and the temporal lobe, which we see in a darker green. And that's why we see so many symptoms that relate to changes in behavior, memory, even like loss of control. That's where the frontal lobe really comes in. It affects our ability to plan, to make decisions, and also control our impulses. Whereas the damage to the temporal lobe in green, you can see memory loss, language difficulties, and sometimes problems recognizing objects or faces. And this really relates to the idea that auditory processing, or how we take in sound, really happens in this temporal lobe of the brain. So we know that if you can't hear, it's going to be harder to engage in conversation. It's going to be harder to make concrete memories, and just understand the world around you in general. So you tend to isolate yourself a little bit more. And we'll talk about this in a little bit, but that increases your risk for developing dementia over time. On the right-hand side of the screen, we see what we call a neuron. This is the main type of cell in our nervous system, which the brain is a big part of. And these neurons act as our brain's tiny messengers. So they help transmit information not only within different parts of the brain, but also from the brain to the rest of our bodies. So if we want to get up to go grab a cup of tea from our kitchen, our brain is communicating with our muscles to get us to do that. And with Alzheimer's disease, we see that there is a disruption in the function with this communication in a few different ways. So, with enough disruption, these changes can lead to our cells not working enough to where they die out in different regions of the brain, specifically, like I was mentioning, the frontal lobe and the temporal lobe, which are very crucial for memory and cognitive function in your day to day life. So, we use dementia as an umbrella term, and it is a symptom that you can develop from different types of diseases, Alzheimer's being the most common cause of dementia. So, with Alzheimer's disease, we see that there are specific proteins that accumulate in our brain, and they form in abnormal shapes or in little tangles that aren't normally found in a healthy brain. So, this accumulation of these proteins develops into plaques that help, or I guess that don't help, transmit information between different parts of the brain. And that leads to cognitive decline. We also have these three different types of dementia: frontotemporal, Lewy body, and vascular dementia. The middle two are basically just same as Alzheimer's in the idea that an abnormal protein is accumulating. And what I mean by abnormal is that it's not doing its normal function in a healthy human, where proteins carry out certain processes that our body needs in order to work well and function throughout a day. This accumulation of abnormal proteins gets in the way of the body functioning normally. With vascular dementia, it's more about a block in blood flow throughout our brain, and that gets in the way of communication within different regions of the brain, and it can lead to what we call a hemorrhage, which is just like a rupture of a blood clot. So definitely can be dangerous if not treated early on. But what I do want to emphasize from this is that dementia in general can range from any one of these causes. Today, though, we'll be focusing on Alzheimer's disease as it is the most common form of dementia. All right, so Alzheimer's disease in general, like I said, the most common cause of dementia, and it is what we say as progressive and neurodegenerative, which basically just means that the change will be slowly and worsening over time. And what we really need to look at is how much your cognitive function has changed over that time. So the typical onset is around 70 years old, but there is also something called early onset Alzheimer's disease. So there are people that can get it around the age of 50, maybe even 45. And we tend to have participants in research at our center that range from 45 to 85, just so we can see not only early onset progression, but also it is known through research that the symptoms for Alzheimer's disease, although they can typically start up later on in life, the changes in the brain start happening 10 years, sometimes even 20 years before. So having research with participants over such a long period of time has really taught us a lot about what small changes we can start to see early on before the symptoms even develop. So with the course of Alzheimer's disease, like I said, it's progressive. So you may start off with some short-term memory loss where maybe you're asking the same questions over and over again in a conversation. Maybe you are forgetting the date or the season that we're in at the moment. And you're also having some problems with orientation. So maybe you're forgetting how to get to the grocery store that you normally used to go to every week. While driving, you might get a little bit lost, things like that. As the disease progresses, we start to see some problems with cognition, behavior, and daily functioning. We see a lot of changes in behavior, changes in mood as the disease worsens. And this can manifest as being more irritable, more angry, more often lashing out to your friends or family, especially in situations where you're out of your comfort zone a little bit. So maybe you're leaving the house, going to a family event, and you tend to see that there. In terms of problems with daily functioning, it might look like not being able to balance a checkbook anymore in ways that you used to. Similarly, maybe not being able to remember all the things you need to get at a grocery store. So you're relying more on written reminders for events, for daily tasks, more than you used to. And I really want to emphasize it's that change in ability that we're really looking at when trying to see if someone's memory loss is really concerning enough to seek out a neurologist and maybe even get a diagnosis. As that disease progresses even more, then we really start to see some loss of memory, whether it's not only just short-term memory, but long-term memory. You'll start to see people forgetting who their family members are, forgetting their children's names, things like that, as well as a loss of attention. Maybe they're not able to follow the news anymore, the plot of a book, the plot of a movie. And then we also start to see some loss of sensory ability. So the ability to see, oftentimes maybe the ability to hear, as we said, that's in the temporal lobe area of the brain. So just seeing sensory loss in general. And again, a more severe type of change in behavior. It's also important to note that Alzheimer's disease specifically impacts Hispanics a lot more than non-Hispanic whites. They are actually 1.5 times more likely to develop Alzheimer's disease. But this statistic really hinges on the fact that Hispanics are not very involved in medical research compared to non-Hispanic whites. And so we're still learning or trying to discover why this difference in risk development is so much higher in this community. And so that's why we're really trying to bring research efforts and education to the Hispanic community today. All right, so now I want to talk a little bit about how we can tell the difference between normal aging and abnormal aging. Normal aging, as you get into your 70s, 80s, 90s, it's not going to be memory loss that affects your daily functions as they will with abnormal aging, which we'll get into in a little bit. So normal aging can look like occasional bad decision making, sometimes forgetting to pay a bill, maybe forgetting the dates every now and then, or not being able to find the right word when you're in the middle of a conversation, as well as misplacing things, but then finding them. And again, I want to emphasize that this is occasional actions that you may see yourself doing. So sometimes I forget where I put the keys. Sometimes I leave them right by the door. Sometimes I put them on my nightstand. Sometimes I leave them in my purse. And that happens to everybody. So if it's an occasional action, completely fine, part of normal aging. Where it can start to get a little bit concerning and more into the realm of abnormal aging is if it is affecting your daily activities. So if it's consistently having bad judgment or consistently being unable to keep a checking book, being able to pay your bills, manage your money, not knowing the season or the year over a long period of time, as well as difficulty during a conversation understanding others or explaining yourself, and this happens every time you're having a conversation, then you really start to get a little bit worried. Same thing with storing your belongings. If you're constantly misplacing them or putting them in places where they're not usually meant to be kept. For example, if I, instead of finding my keys in my purse, I'm finding them in the fridge or in the bathroom, maybe things that we wouldn't normally think to place them there, that's where it can get a little bit concerning. Similarly, if you find your toothbrush in one of your kitchen cupboards, something like that. So again, it's definitely important to look at this change over time, but if it's a consistent action that is happening, even in a short period of time, that can be cause for concern as well. Here we have a list that the Alzheimer's Association published with 10 early signs of Alzheimer's disease. And so you can see these in other people, especially. It might be a little bit harder to track them for yourself, especially if you are developing some type of cognitive impairment. But I'm going to go through each of these and say a little bit about each one, give some examples. So the first is memory loss that disrupts daily life. And this is one of the most common signs of Alzheimer's disease in early stages, especially like forgetting recently learned information. Again, we've talked about forgetting important dates or events, repeating questions. And this is really one where if you start to consistently rely on written reminders, whether it's a calendar, some sticky notes, or even your family members reminding you that a certain event is coming up, that can be cause for concern a bit, especially if they didn't used to need those daily reminders in the past. The second is any challenges in planning or solving problems, especially the ability to follow a plan, work with numbers. We can see that not only in balancing a checking book, for example, but also following a family recipe or keeping track of bills once again. This really manifests itself as difficulty concentrating on a certain task and often taking longer to accomplish a task than they used to before. The third is difficulty completing those familiar tasks. So it can be driving to a familiar location, organizing that grocery list, even remembering the rules to a favorite game. So if your parents or grandparents like to play dominoes, but they're not really remembering how to do that, that can be a cause for concern, especially if they've played it throughout their entire lives. A card game, same exact thing. The fourth is confusion with a time or place. So not only losing track of dates, seasons, and the passage of time, but often forgetting where they are or how they got there. And this can also be seen as if someone has trouble understanding something that is not happening immediately in front of them. So maybe if you're retelling a story about your day or a past time in your life, and they're not really able to keep track of the logistical timeline of that, that could be a cause for concern. The fifth is trouble understanding visual images or spatial relationships. So, like I said, some people can experience sensory changes, not only with vision, but also with hearing. So, that can lead to difficulties with balance or trouble reading, as well as trouble with driving because it causes some problems with judging distance, being able to determine the differences in color or contrast on the road, all encompassing spatial relationships. The sixth is new problems with words in speaking or writing. Again, that idea of new problems is a change over time. And so, with people having trouble following or joining a conversation, they may struggle with specific vocabulary in naming familiar objects. For example, if I normally call a watch, you might hear someone that's developing Alzheimer's call it a hand clock or the thing that tells time. Sometimes they'll describe something with its purpose or how they use it rather than using the actual name for it. Similarly, with scissors, someone with Alzheimer's disease might do a little hand motion that they know what the thing does, but they can't come up with the right word for it. The seventh is, again, misplacing things and losing the ability to retrace those steps. This can happen to anybody throughout their life, but if you see it more consistently, it may be a sign of early Alzheimer's disease. And with that misplacing of objects, people with Alzheimer's disease also tend to accuse others of stealing. It adds to that idea of a mood change with the irritability, the anger, and a quick lashing out to assume somebody must have taken it because they don't remember misplacing it themselves. The eighth is decreased or poor judgment or decision making, especially when handling money. You can also see this as paying less attention to the person grooming or keeping themselves clean. And we'll talk a little bit about how Alzheimer's disease increases the risk for other comorbidities, such as depression. But the idea of not wanting to keep yourself clean mostly hinges on not remembering that that is part of like social norms. Maybe they don't care as much about it anymore. It's a change in mood and behavior, as we've been talking about for the past few minutes. All right, number 9 is withdrawal from work or social activities. And this is really a result of those changes in ability to hold a conversation or follow a conversation. If you're having trouble expressing yourself, you're going.
Yeah, I think that we have a connection problem there. Let's give her a minute. It's probably gonna get back. Okay. I think that's just joining again.
Hi, I'm so sorry. My Zoom crashed. Sorry for that. I'm going to go ahead and share my screen again. Let's play from the current slide. Can everybody see the PowerPoint again?
Yes, we can.
Okay. Thank you so much. I'm so sorry about that disruption. Okay, we were on number 9. So withdrawal from work or social activities. We already talked about not being able to hold those conversations. So you start to retreat because maybe you're a little bit embarrassed. Maybe you just are tired and overwhelmed from not being able to follow those conversations. And so you isolate yourself, which we'll talk about being a risk factor for even worsening that dementia. So people can become a little bit like sad with that. And we'll talk about how that develops later on. For number 10, the last early sign is changes in mood and personality, which you really start to see over time. But patients with Alzheimer's disease can become easily confused, suspicious, especially with that accusing others of stealing, just suspicious of people's intentions. They can also become depressed, anxious, fearful of the world around them. So they can be easily upset, not only outside during overwhelming events, but even at home with friends and family as they start forgetting that these are people that they've had around their whole lives. So here we have a little bit of a puzzle of all these different risk factors that contribute to someone's ability or risk for developing Alzheimer's disease. And we can see that a lot of different things come together to play into that risk. But there is one puzzle piece with a bunch of question marks, and that's because we are constantly learning about all the different risk factors. There's not a whole picture that's already perfectly laid out. And that's why research into this disease is still ongoing and so important as we keep learning more and more about what we can focus on to prevent the illness from developing further or from even developing at all. Does anybody have any ideas of what other risk factors may contribute to developing dementia? You can either send it in the chat or unmute yourself if you have any ideas. All right. If not, that's okay. We're definitely still learning too. But here we see a lot of them listed. So the idea of education, age, genetics, gender, family history, a lot of these are things we can't really control. But as you get older, if you have a family history of Alzheimer's, which also ties into the genetics of it, these are all things that can increase your risk for developing. Not saying that you will develop it as you get older, but you're just at a higher risk. Similarly, your lifestyle. So if you tend to not be very active in exercise, or if you don't tend to eat healthy diet, um, or if you tend to isolate yourself. So if you're not engaged socially, those are higher risks as well for developing dementia. With medical problems, we see a history of head injury, any mood disorders, cardiovascular health issues, sleep related issues, all contributing to just not as healthy of a life. And that increases a risk factor for Alzheimer's disease. So now I want to talk a little bit about, can memory loss and dementia be prevented? I feel like sometimes people think about dementia and it's this cascading, scary memory loss that you can't really control. But there are a bunch of things that you can change in your lifestyle that may slow that progression and overall make you healthier in terms of physical, mental, emotional health. So we'll talk a little bit about those today. A lot of studies have proven that everything that is good for your heart is also good for your brain. So we start to think about exercise, a healthy diet, not smoking, not drinking as much. We tend to think that keeping our heart healthy is really, really important because over everything, it makes our body work, right? It's pumping our blood. We need it to survive. But our brain is kind of the same thing. We need our brain to survive in order to keep who we are intact. So we'll look at a couple of preventative measures that we can do to keep both of these healthy. Dr. Tanzi is a doctor at Mass General Hospital that specializes in genetics and aging research. And he developed what we call this shield plan. So it touches on a couple of different preventative tactics that we can really focus in on to make sure that we're living as healthy as we can to keep our brain and our heart healthy. So we'll start with sleep hygiene. The CDC has done a couple of studies that have proven that the older we get, the more sleep we need, just as when we were babies. So between 7 to 8 hours, maybe even 9, if you can get more, that would be great. To sleep per night is really important because as important as exercise might be, right? Sleep and recovery is just as essential to make sure that our body is recovering in the way that it needs to. It'll boost our energy, our ways of thinking, and our overall bodily functions to not have to waste as much energy in a day's cycle. So ways to get better sleep is first of all to be as consistent as you can. So if you have a routine around your sleep schedule, going to bed at the same time every night, waking up at the same time every morning, it's just going to really sync up that what we call the circadian cycle of sleep. And I know that's definitely easier said than done, especially if you have family that you're taking care of, a work that might change in hours throughout the week. So just trying to be consistent is important, as well as getting some exercise during the day, whether it's an easy 30-minute walk or something a little bit more strenuous. It can just help you fall asleep more easily at night because your body is a bit more tired from the day's work, as well as your bedroom setup. So if you're in a quiet, dark, relaxing environment, if you like to sleep when it's cold or hot, setting that temperature to what you like and feel comfortable at, as well as having no electronic devices near you. So if you like to be on your phone very late at night before going to bed, that's definitely disrupting your ability to sleep. I'm sure we all like to watch a little TV show, a movie, maybe read an article on your computer. But again, that screen time is just going to hinder your mind's ability to shut down as you're getting ready for bed. Another thing to avoid is large meals right before bed, just because then your body's in the middle of digesting it. It's not preparing itself to rest for the night. Similarly, with caffeine or alcohol, your body is going to be breaking that down, not focused on sleeping. And caffeine, especially, is what we call a stimulant. So it's going to keep you up. It's not going to help if you're trying to go to bed. If even with all of these things, your sleep is still not as great as you want it to be, maybe you're having trouble falling asleep, staying asleep, whichever, you can definitely always talk to a doctor. And they will either be able to tell you exactly what is wrong, maybe help you change other lifestyle factors that might be contributing to your sleep habits, things like that. All right, the second part of the SHIELD plan is handling stress, which I'm sure we all experience stressful situations in a day-to-day life, even at home. And so just making sure that you're handling that as well as possible for yourself is really important. So this can be establishing a meditation practice or a mindfulness practice, and that can manifest itself in a bunch of different ways, whether it's through exercise, through talking to your loved ones, or even a third party if you would rather speak with a specialist that might be able to help you process those emotions a little bit better. It could also be spending time doing the things you love. So if you love being outside, going for a walk in nature might help de-stress a little bit. Focusing on a hobby if you have the time to. Sometimes I like to read because it kind of turns my mind off. As well as yoga practice is another great way to really focus on not only that meditation and mindfulness aspect, but also get your body moving in a way. Sometimes just sweating a little bit helps to relieve the stress, even if it's in an unconscious way. All right, the third part of the plan is interaction with friends. I'm sure that we all love spending time with the people that we love, and research has proven how not only that increases our happiness, but it also is correlated with a reduced risk of developing dementia. So, not only how often you spend time with friends, but also the amount of friends. So your social network size, that's what we call it, is always correlated with the risk of dementia. So women have been found in this study of like almost 2,200 women that those with larger social networks were 26% less likely to develop dementia compared to those with smaller social networks. So that doesn't only have to be friends, but it can also be anybody you're interacting with in your community. So if you go to a coffee shop, if you go to the grocery store, if you go to a senior center, just making sure to try to engage in conversation with the people around you, which I know in today's world might seem a little bit scary if we're all glued to our cell phones or just involved in our own lives. But I promise that it really makes a difference, especially in not only reducing your risk for dementia, but making you happier overall, more connected to the people in your community. This study also found that women who had daily contact with friends or family cut their risk of dementia by almost half. And that really ties back to not only not isolating yourself, but keeping up with social interactions, conversations, keeping up with other people's stories and lives. It really works the muscle that is the brain, different parts of the brain. So it's not letting those neurons that we talked about earlier and those connections really die out. Um, so overall, the emphasis with this slide is that social engagement really helps reduce not only the risk for dementia, but it helps reduce stress levels, prevents loneliness. And these are both, we've talked about risk factors for developing dementia. So it's really all tied together. All right, the next part of the shield plan is exercise, which I know can be a little bit hard to get into a day, especially if you're working, dealing with other things at home. It might be the last thing on your mind. But walking is a form of exercise. So even just getting 30 to 60 minutes a few times a week, or even if you're not doing any exercise right now, but you start doing it 1 day a week and then transition to 2 days, 3 days, as long as you're putting a little bit more effort into incorporating this in your day to day life, it will help reduce that risk of not only developing dementia, but especially progressing from earlier stages to later stages. Um, Improving fitness through regular exercise has been shown to not only boost memory and daily functioning in patients with dementia, but also improve your attention, your executive function overall. Another thing we can do to prevent developing dementia is learning new things. So, as I said, the neurons in our brains are constantly communicating, and they're communicating through what we call synapses. So, these are basically just connections between nerve cells that store our memories, not only over time, but also memories in terms of how we do things. So, the act of riding a bike, the act of knitting a sweater, things like that. So, as you learn new things, pick up new hobbies, you strengthen and increase the number of connections in your brain. And the more that you make, the more you have to spare later on as some of these cells start to die out. So, a Harvard Health article has stated that practicing new and challenging activities are a good bet for building and maintaining cognitive skills because, again, you're working that muscle. You're not letting those cells die out. So, learning new things is definitely going to help in preventing the risk for dementia. You can always learn a new language, take a class, read a book about a certain topic that you're interested in. Picking up a hobby is always fun. So, if you want to try gardening, if you want to try playing an instrument, if you want to, I don't know, knit a sweater, like I was saying before, whatever you think you may be interested in, learn it because it will definitely help reduce that risk. And if you learn it with friends or a group, then you're knocking two birds out with one stone. Not only are you in a social environment, but you're actively learning new things with new people. You're holding conversations about that. And that's why I love the idea of book club so much. It's a mix of all of these things that really just help keep us engaged in our community, learning new things about new topics. And yeah, it's always a fun activity too. Okay, the last part of our shield plan is keeping a good diet. So, a lot of studies have shown that anti-inflammatory diets, which the main one is this Mediterranean style diet, They're both good for brain and heart health. As we've talked about numerously, they are linked. So having a Mediterranean style diet not only lowers the risk for progressing from an early stage of dementia to a later stage, but it also lowers the mortality rate for Alzheimer's disease patients. Because if you tend to eat not well, it will also increase the risk of other health related issues, especially cardiovascular issues related to the heart, digestive issues, brain issues. They're all kind of linked in a way. So, this Mediterranean style diet really emphasizes eating fresh fruits and vegetables, beans, lentils, and nuts, as well as fish as a source of protein, whole grains, and olive oil, which is a little bit surprising, but olive oil has some healthy fats in there that are also just as important to incorporate into your diet. In moderation, you can have poultry or chicken, eggs, dairy, and wine as alcohol. There have been studies in the past that showed a little bit misconstruingly that alcohol might be good for you. This idea of having a glass of wine at dinner isn't all that bad. But again, in moderation, you don't want to go too extreme with it. Some of these studies that have shown it might be good for you, if you really look at the patient data behind it, they're taking two groups of people, one that can drink and one that cannot drink. But then you start to ask, well, why can't those people drink? Maybe they have another health issue that limits their ability to consume alcohol, and maybe that's skewing the results a little bit. So, again, just in moderation. And things to avoid, as always, any sweets with refined sugars, anything that's been processed, especially with today's chips and candies and sodas. It's easy to, get caught up in that. But as well as red meats, saturated fats, especially in salted butter, can be not necessarily that you have to cut them out completely, but avoid them as much as you can. Try to balance it out with fruits and vegetables, better sources of protein, things like that. All right, that was everything that I had for today about the basics of Alzheimer's disease, how to prevent a progressive disease like dementia. If you ever want to hear more about the clinical trials that we're working on at the Center for Alzheimer's Research and Treatment, please feel free to contact us. I have our phone number here on the screen. You can also visit our website to learn about the kind of work we do. And if you ever want to contact me, I can send my email in the chat. But we'll also be doing another session next Friday and the Friday following, where we'll really talk about clinical trials and community resources that you can use to your ability. So if you have any questions, please feel free to unmute yourself, send them in the chat. I'm happy to answer anything I can.
Stephanie, can I ask a question? So I know that you mentioned about the Latino Hispanic community being more at risk for developing Alzheimer's. How can we help as an institution to get more people to be involved in the research?
Yeah, that's a wonderful question. Thank you for caring to help as well. I think just with these educational series, what we're really trying to do is get the word out to the Hispanic community that there is a real difference between normal aging and abnormal aging. As a Hispanic myself, I tend to see my grandparents kind of blow off a lot of symptoms that develop as you age, and that's just part of the culture. But just really educating them on what these symptoms are can help at least push them a little bit more to get checkups with the doctor. I know that another huge barrier is having access to clinicians that can make these diagnoses. And so, what our center is really trying to do is educate other community clinic staff on diagnostic procedures that can make these evaluations more accessible to their communities. But in terms of what Neighbor Health as an organization can really do is if patients are expressing concern about their memory changes, if you want to point them towards our center to not only learn more, but if they want to get involved in research, that's not only a way that they can start caring for their own health, but also help the community around them. Yeah. Any other questions?
I think that my question was related to the same thing, how I can also be more involved and try to help the community. And as you mentioned before, now that I think about it, being a Latino as well, and I think about my grandparents, my aunts, and family back in DR, I do see that it's easy for the community of Latinas to think like, oh, this is maybe something normal. This is something that is normal to happen when you're aging. So it's good to have those points, and super grateful that you point out those important tools that we can use and be like, oh, maybe we can see something more on that. So that's super good.
Yeah, absolutely. And I know that seeing a lot of these symptoms can be scary, especially as we even think about approaching the conversation with, let's say, your grandparents, maybe even your parents, if they want to help start that conversation. And what's really important to note is that sometimes the first conversation is not going to be successful. A lot of people tend to push back on the idea of their memory loss being that drastic or that bad. But just coming from a place of love, of care, and really making that emphasis is important. Just making sure that they feel safe, especially in the environment that you're holding that conversation with, the people that you're involving in that conversation is really important. Any other questions? Okay. Well, that was everything I had. I am going to send my email in the chat in case you have a question that you want to share with me individually. Please feel free to reach out. Or if you come up with any questions later on today, throughout the week, in the next months, whenever you need, I will be there. And then I'll also be here again in the next 2 Fridays if you want to come back and join for the following sessions. And if you have anyone that you think would benefit from that type of information, please feel free to spread the link. I would love to have anybody else join.
Thank you.
All right. Everybody have a good day. Thank you so much for having me.
Thank you.
Bye.